Hey, everybody. Welcome to another episode of Confessions of a Male Gynecologist. I'm your host, Dr. Shawn Tassone, and I wanted to take you through a little bit of a journey today and kind of feel like a need to start over with everything that's been going on in the country and all that we've all been kind of going through with stress and fear. And I wanted to put this episode of the podcast and just kind of start from the beginning. I've been doing this now for a while, and what I wanted to do was start with a story. And I like stories because I think that we connect better with story. I think that we understand each other better through metaphor, analogy, stories. And so for me, the story begins, and for those of you that have read my book, The Hormone Balanced Bible, you'll recognize maybe the story, but you'll also recognize the fact that it's kind of nice to talk in a language that you know. And so many of you that talk to physicians tell me all the time that you don't feel like you're being understood. You don't feel like your doctor understands you or cares. And the point is that they do care. It's just that maybe they're not understanding where you are coming from. And my friend Larry Dawsey, who is a physician that lives currently in New Mexico, Larry wrote probably 7 or 8 books on healing and non-locality. He's been on Oprah way back in the day, and he's probably in his 80s now. But Larry is a friend of mine, and he tells this story of a friend of his who had a lodge I think in the mountains of Colorado, or it could have been Santa Fe area. And this guy had a restaurant, and the restaurant was well known in the area, and people stopped and ate there all the time. And he had an item that he wanted to put on the menu called beef stroganoff. Now, for those of you that I kind of feel like beef stroganoff is like one of those old fashioned recipes now, but growing up, you use those egg noodles, the kind of flat egg noodles, and you make this wine reduction type cream sauce with mushrooms and sauteed beef, and it's called beef stroganoff. I'm obviously not doing it justice, but it's delicious. My mom used to make it. It's quite delicious, actually. And anyways, the guy put beef stroganoff on the menu, and it didn't sell any, like none. Like nobody ordered it. It was the special for like 2 months, and nobody ordered it. And Larry went to visit him and ate it and said, "This is like the best thing I've ever eaten. It's delicious." And the guy said, "Well, I'm happy to hear you say that because I'm taking it off the menu because nobody's buying it." And Larry was like, "I can't believe that. What do you mean?" He's like, "I've had beef stroganoff on the menu for months." And so Larry kind of asked him, like, what is your demographic? Who is your avatar? Who are the people that are coming in here and eating it? And most of them were locals, the local folks that lived in the mountains at the time, probably 30, 40 years ago. And probably had never heard of beef stroganoff. So Larry said, "Well, let's just try something. Let's rewrite the specials board tonight and call it beef with noodles." And the guy was like, "Well, yeah, but that's what it is." And Larry's like, "Just try it. Just put beef with noodles on the menu." So the guy said, okay, and he did it. And that night they sold out. The next night they sold out. And the next night they sold out. And now, 10 years later, it was probably the number one dish on the menu. People would come in from out of town to order it. The point of the matter is, and Larry called this the beef stroganoff principle. And the beef stroganoff principle is that concept that you need to, if you want to try to be understood, it's always nice to try and speak somebody else's language. If you don't speak their language, you're already starting down this awkward path. And nowhere have we seen this better than in the recent political race. Neither side knows how to speak to the other side without insults or barbs. And hey, I'll be the first one to admit that I'm probably guilty of some of that myself. But if you want to talk to a physician, if you want to get the physician to do the things that you would like to do, you need to talk in certain mannerisms. And the mannerisms are, we like diagnoses, we like studies, we like, answers to things. And so when you go into your doctor and you say, I want to order this lab, this lab, this lab, and this lab. And they'll say, why? If you say, I just want to know, or I'm curious, or, somebody online said to order them, do you think that that would be as good of a response as if you said something along the lines of, well, yeah, I know I've been reading online, but I will tell you, I have insomnia really bad. Like, it's interfering with the way that I live my life. I have no periods, whatever it is. You're now speaking in the language of diagnoses and problems that they can understand. And they might be, and I'm not saying they still would, but they might be a little more inclined to order those labs. And then if they still push back on you, I always have people ask me, what can I do to get my doctor to do this, this, or this? And my answer is always the same. You can't. You're not going to get a doctor to do anything. If they don't want to do it, they're not going to do it. It's unfortunate, but they won't. Because the reality is this, as far as labs go, it doesn't cost me any money to order you labs. It literally costs me absolutely nothing to order you labs, just the time it takes me to click the buttons to order it. And I'm not in the business of trying to save the insurance company's money. As a matter of fact, I could care less. They make enough goddamn money as it is, and so do their people. It's not something, the CEOs. I don't care about how much money an insurance company makes, and I don't get paid by an insurance company, so I don't care. That being said, it's no skin off of my back to order labs, and I will order them all the time. And I do that all the time. I have people ask me for labs that I don't ever really order. And I might ask why, just because I'm curious as to where they're coming from. But the point is, you're not going to get them to change their mind. So if they don't change their mind, then you have to understand that you probably just need to find someone else. That wasn't the story that I wanted to tell. I wanted to tell the story of a kid about 42 years ago in the kitchen at home, mom standing there, yelled at me for something that I'm sure I had absolutely no part in. I'm an only child, so it was just me and my mom in the kitchen. And she was making me angry. I was 15 or 16, and I think I wanted to go out and do something, and I wanted to drive somewhere, and she didn't want me to. And anyways, we were arguing. And I looked her dead in the eye, and my mom was probably in her early 40s. Yeah, maybe late 30s. But she had a hysterectomy when she was like 32, and they removed one of her ovaries, and I think she was on hormones. But I don't know for sure, but she was taking a pill, and I'm assuming it was probably Premarin. And I stopped and I said, hey, did you take your medicine today? Now, I would make a recommendation to any man out there to never do that, especially to your mother, but never do that, because that just makes you look like an idiot. And I was 16, so I was an idiot. And I want to joke and say that I blacked out after that and I woke up like 3 days later, but I think I probably made my mom mad and she stormed off. But the point of telling that story is that even back then, 40 something years ago, at the age of 15, 16, 17, it was ingrained in my head as a youngster with no internet, no cell phones, that women's problems revolved around their hormones. And so I knew my mom's hormones must be off, and that's why she was acting crazy, and that's why I made that comment. Even back then, in those days, I somehow had learned as a young male that women are hysterical, women aren't sensible, women are crazy when their hormones are off. And I still don't to this day know how I learned that or why I learned that. It has to have been television. That's the only thing I can think of. But suffice it to say, we used to think that women's problems were all in their heads or their hormones. Like you couldn't, as a female, just be mad. And looking at that scenario, it certainly wasn't me. I wasn't the problem. I was a 16-year-old kid and I was perfect. And I think that still permeates society today. I think women are treated like it's all in their heads. They're a problem. They're just over dramatic and, the whole 9 yards. And it's so wrong. It's so wrong that we think that. I don't think the dynamic has necessarily changed very much in the last 40 years, if I'm being completely honest. But the point is how do women advocate for themselves when they are already at a disadvantage? And I'm saying this 40 years ago, medicine was definitely a patriarchy. Most of the doctors were probably men. Probably 80% of OBGYNs were men. Now it's flip-flopped and probably 70%, 75% of OBGYNs are women, but they still treat women as a patriarchy. And I don't like to use that word patriarchy because it implies that it's male run, and it's not. So I like to use the word doctorarchy. It's a doctorarchy, and we unfortunately feel like, one, it's all in your head, and two, hormones aren't really necessary. I mean, how many of you have been told we don't do lab testing? We just treat based on symptoms, but your symptoms aren't bad enough. Or, you're only 42. You can't be having problems. You're fine. I had a lady in the office yesterday who was having a lot of anxiety and kind of ADD type behaviors. And the doctor literally told her, and this was a male physician, which is even worse, but the doctor told her she just needed to have sex more often. And I was just like, what? I mean, what? A grown man saying this, she needed to have more sex. Oh, okay, well, that'll fix everything. That's just sheer stupidity, obviously. So I would say this. In order to advocate for yourself, know what you want ahead of time. Have questions ready, because I will tell you, most physicians are probably annoyed by that doorknob question. We call it a doorknob question, where we turn around to leave and then they say, oh yeah, one other thing. Or when I ask, hey, do you have any questions? No, I think you've answered all my questions. And then I turn around, and as soon as I turn around, well, I do have one question. Try not to do that. That's probably annoying to anybody, but try to have your questions ready. And just go through them one at a time. I mean, within reason, you have 15 minutes or so. Within reason, probably hit your top 3 to 5 things that you would like to have fixed, and then go through them. If you don't like the answers you're getting, you can always push back a little bit. You can be nice about it. Like, well, I'd really like to get a hormone panel. I'd like to have my hormones done. Oh, well, there is no such thing as a hormone panel. Oh, well, could I get my estrogen levels checked? Oh, yeah. Could I get my testosterone checked? Yeah. They just don't know what a panel is, because technically there is no panel at the lab. They have to order labs separately, each individual lab. So there's no technical panel. So they might push back on that. And then if you get the labs ordered that you want, they may say, I'll order them, but I really don't know how to interpret them. I don't do that. It's not in my wheelhouse or whatever. At that point, they're just telling you they want to help you. They want to do what you want to do, but they're not going to be helping you with prescription, because they just don't want to deal with that. And you should just be like, okay, well, do you have any recommendations? That's a death knell for a doctor if you're going to have recommendations to go see someone else, because you're voting now with your wallet. And if you leave, we lose revenue because you're going somewhere else and you're taking your papers and you're going to a different physician, not to mention that it's a little bit of a sting to the ego. Now, I know you can't please everybody, and there are going to be people that leave to go elsewhere because they just want to find someone they resonate with, and I get that. So be prepared for that. Be prepared for, we don't get labs because I don't base my prescribing on labs. Again, they are putting up boundaries. They don't want you to push past. And out of respect for them, if they're being open with you about that, then you should respect that. They don't want to do it. It's not in their wheelhouse. And you want somebody that knows what they're doing. And I don't think it's necessarily wrong for you to say, do you have any recommendations? Is there somebody you would recommend I could go to? More than happy to come back here for my annuals or whatever. But I just feel like this maybe isn't something you want to help me with, and I'm just looking for somebody. Like, I have a few doctors in town who love to do endometriosis surgery, but they don't want to deal with people afterwards, meaning what do we do to prevent it from coming back? And so they learned that I was doing stuff with hormones, low dose naltrexone and supplements and things like that to help with women to try and minimize that reoccurrence of endometriosis. So they just started sending the patients to me because they didn't want to deal with it. And they knew it was something that I was doing. Now, every community isn't like that. As a matter of fact, even in Austin, there's a lot of people that are like that. And they're constantly threatened by things they shouldn't be threatened by. But suffice it to say, speak to the doctor in the language that you can. Be respectful. Have your questions at the ready. Be respectful of their time as they should be respectful of yours. And be ready to walk if you don't get the answers that you want. Because there are tons. There's 20-something thousand physicians that do OBGYN out there. And nowadays with telemedicine, the possibilities of you reaching a care with someone that you hit it off with are pretty high. But you have to be aware of these telemedicine companies. There's a shit ton of them out there now, unfortunately. And they're all, what they're doing, I can tell you exactly what they're doing, is they're cherry picking. They're looking for a volume. There's no way that those online places can charge $100 for labs and $50 for the visit without doing volume. They have to do a ton of volume. So what are they doing? They're cherry picking the easy people, the 54-year-old that's having hot flashes and isn't sleeping, and they'll just put her on a estrogen, progesterone, like a patch and they'll use her insurance and they'll just get her going, and then they'll have her pay $450 for the year if she wants to get her prescriptions and blah blah blah. But you never see the same person twice because they're moving you around. Chances are they're hiring mid-levels, PAs, NPs, and they're moving to different companies because they hate the jobs because they're horrible. They don't pay you very much, and it's a hormone mill. They're just rotating people through. So I had a lady today tell me she's seen 3 different providers, and when the going got tough and she started asking more questions about, can I change this dose? I'm not feeling this great. They basically told her they couldn't offer her anything else. That's because they don't want to try, because the more complicated you are, the more time you take, the less volume they can generate. And it's a volume-based business. That's why it's so cheap. You get what you pay for, unfortunately, in everything, clothing, whiskey, wine, not always, but sometimes. Meat, seafood. I'd rather pay $30 for a good steak than $1 for the same steak. It's about quality, not quantity, I guess, especially in hormones. So then what you can expect after, even if you get your labs drawn, even if you find someone that will interpret those for you, then you got to get a prescription. Now, talked about this incessantly. There's a movie out there, and maybe I'll talk about it one day, called The M Factor. It's put on by the Menopause, Tamsin Fadal, Sharon Malone. What's her name? Mary Claire Haver, Kelly Casperson. They're all women. And there's no men involved except for Avron Blooming, and he's a medical oncologist. Otherwise, there's no men. Absolutely zero. And if anything, they're excluding men on purpose, which, it is what it is. I'm all about spreading the word and whatnot. But they will only talk to you about the recommendations by the Menopause Society, North American Menopause Society. They won't go outside of those guidelines, except for like they usually won't prescribe testosterone. My Alloy usually will not. That's owned by Sharon. Sharon Malone is the medical director. And the reason is because the North American Menopause Society doesn't think testosterone is necessary. Kelly Casperson in the movie will talk about using androgel, which is a male dosed gel. And she'll tell you to just put a little bit on your finger and rub it in. Problem is, if you've ever opened one of those packets, it's runny as all hell. It's super thin. To get out a metered dose without ruining the entire packet is ridiculous. So the packet is a high dose of a male hormone. You're supposed to squeeze it out somehow. It's not like toothpaste. It's more like just oil, and it runs everywhere. And for you to get a smidge of that to try and rub it on is completely ridiculous. And why she would do that and not use compounded hormones, I have no idea. So that's another question you can ask your doctor when you're out there searching. Before you even get too deep in, do you prescribe testosterone? Do you believe in bioidentical hormones? Do you compound hormones? Those are questions that need to be answered by you on your journey. That will just help you from the beginning to know if that doctor is going to be a match for you. Like, I don't put a whole lot of love and energy into stool testing for food allergies because those tests have been shown to be highly unreliable and unreproducible. People are out there paying hundreds and thousands of dollars for these tests that have absolutely no factual basis in them. And I just don't like spending people's money unless I know that it's going to benefit them. So have your questions ready. Ask the providers questions about themselves, their training. Ask them where they trained. Because I'm here to tell you, everybody's an expert. Everyone. If you go to a provider's webpage and it takes you more than 2 minutes to find out what they are a doctor of, there's a reason for that. They're hiding it. They don't want you to know they're a chiropractor. They don't want you to know that they have a doctorate of clinical nutrition, like the thyroid fixer that's out there. They're hiding it because they want to use the word doctor, but they don't want to tell you what they're a doctor of because that would expose them as probably not having the expertise. It would be like you coming to me and me saying I'm a doctor, which I am, but I just say you come to me thinking that I'm a chiropractor. And I tell you, yep, I'm Dr. Tassone and I'm here to crack your back. But I've never done it. I don't know anything about it, but I'm a doctor. So you imply that I know what I'm talking about. They imply they know what they're talking about. They're hiding what type of doctor they are. I would want a chiropractor if I was seeing a chiropractor and not an OBGYN. Also, a little trick of the trade. If they use doctor, like if I was to call myself Dr. Shawn Tassone and use the DR at the beginning, but not the MD at the end, that's always a tip that maybe they're not an MD or a DO because they're hiding it. Again, they don't want you to know what they're a doctor of, so they use the word doctor. Like the lady I just mentioned says Dr. So-and-so, but she has no MD, she has no chiropractic, she's not an acupuncturist, she's a doctor of nutrition, but she's an expert in thyroid care. No, that doesn't work. You're not an expert in thyroid care. You're an expert in maybe nutrition, but not thyroid care. You can read a lot about it, but you're not an expert in it. Expertise takes years and years and encounters. If you've read the book by Malcolm Gladwell, where he talks about expertise, he came up with this concept that you need 10,000 encounters or hours to come up with expertise. There's a couple of ladies out there who, again, no medical background whatsoever. One of them trained at the Institute of Integrative Nutrition. One of them's a lawyer. But they went through menopause. So they're experts. No, you're not an expert. You're an expert in your menopause, but you are not an expert in anything remotely related to healthcare, remotely related to hormones or nutrition. The Institute of Integrative Nutrition is somewhat of a joke. But anyways, and yet they wrote a book. So now they're experts because they wrote a book, which I wouldn't even recommend reading. What a waste. But that being said, they talk about their expertise, but I have seen on the backside what they do, and they have absolutely no idea what they're doing. Because what they do with their quote unquote expertise is they regurgitate what they've learned from other people. Those people could be crazy, they could be excellent, who knows? But that's all they do. Their expertise comes from the expertise of others. So let's say these women who claim expertise in their practice, which who knows what it is, practice, they say they practice, but they can't, because if they did, they'd be committing a felony. But let's say they saw 5 new patients a week, 20 new patients a month, 250 new patients a year. How long would it take them to have 10,000 patients? About 20 years. No, longer than that. Yeah, it would take them 40 years to have 10,000 patient encounters. 40 years. I see 20 patients a day, 60 patients a week, sometimes 80, 300 patients a month, 3,500 patients a year. It would take me 3 or 4 years, and I've been doing this for 20. That's how you get expertise. You get expertise by doing, not by regurgitating other people's nonsense. When you are vetting a provider, you need to ask those questions. Where did you train? What's your background in? How did you get your expertise? How many people do you work with? You know, I saw 1,000 new patients last year. And I actually prescribe medicine. I follow up with them. I see what they're feeling. These people can't prescribe anything, these experts. So find the moral of the story is to find the person that you resonate with. Obviously, if I see 100 people, 1 or 2 probably won't gel with me. Maybe they don't like the way I do things. But it's up to you to be your own advocate. So the reason that I wanted to tell those stories is because the Hormone Balance Bible is the 12 most common hormone imbalances in women. And what happens with the Hormone Balance Bible is I take those 12 imbalances and I turn them into archetypes or stories. The queen, the nun, the overachiever, the underdog, the saboteur, the workaholic. There's 12 of them. And these stories resonate with people, with women. And when they resonate, you connect. And then I have a 6-step protocol called the Shines Protocol that came from my 20 years of working with patients. The S is a spiritual practice. H is hormones. I is infoceuticals, meaning the energetic things you can try. I call that my 20% woo factor. N is nutrition. E is exercise. And the other S is supplementation. And the beautiful thing about the 6 steps is that you only need me for the hormone part if you want to do that. The rest of these things you can do on your own, which is great. So I would grab a copy of the Hormone Balance Bible. If you're tired of scrolling through Instagram and you want to learn more, I have a membership called the Hormone Project. It's at thehormoneproject.com. It's a group of women that want to go deeper. They want to get a better knowledge base. They want to ask more succinct questions. They want to have live webinars with me and my friends who will come in and talk. This month is all about thyroid. I've probably got 4 videos on thyroid. We're going to add more. It's a place for you because monthly I will have a live webinar where we'll get on and you can ask live questions. I'll pick a topic. Obviously, this month's going to be thyroid. We're going to go deep. We're going to talk about labs. We're going to talk about all the things thyroid. And so if that appeals to you and you want to go farther, please go to thehormoneproject.com, sign up. It's a monthly membership. You can stop at any time, but I don't think you're going to want to. Anyways, this started out me talking about stories, went into a little advocacy. Remember, it's all about you. It's not about us as physicians. When I'm sick and I go to a physician, I want it to be about me too. So that's how you should be treated. You should be treated with respect and sometimes you're going to get back what you put out. So please go into it with respect. Have your questions ready, and let's get some lab work done. If you need me, I'm here in Austin. I'm seeing patients. I'm licensed in 37 states. So look forward to working with you. Have a good one.